Blossoms Life, which is me talking about my life. This is the second video, so I'm very new with this channel. I do have another channel, which is totally different from what this one is going to be. This is all about chronic illness. In the other video that I did earlier, that was just a bit of an introduction as to what my page is about, or is going to be about, my channel, and yeah, just tell you as much as I can about chronic illness and follow me on this journey, because this is just the beginning of my journey basically. So for today's video, I thought I would just say what chronic illnesses I have, and I may give a little bit of what some of them are, but I'll go into detail in other videos that that I will do from now. So I have, and I've got a notebook here, so I've got it in little point form, but in January, and it's now August, in January I was officially diagnosed with gastroparesis, which gastro meaning your stomach, and paresis is paralysis of like it could be partial or full paralysis of the stomach. So the stomach doesn't work the way it should to get the food out in a certain period of time, so it empties very slowly, which can end up making you feel sick, vomit, get chronic pains, all those sorts of GI issues, but to the extreme. And gastroparesis is actually a very rare illness. It's not, like, you can't cure it, you've got to just manage the symptoms that you have, or manage whatever sort of complications pop up with this type of illness. But so I have that, and I also have the esophageal dysfunction with swallowing. So my muscles are not working the way they should in my throat to get the food down, so I end up choking on it, it gets stuck, and I'd have to find a way to try and get that back up so that I don't breathe it back into my lungs. So I've got those, and like I said, I won't go into detail with this video, but it's just telling you what disorders or illnesses that I do have. So that's those two, and they're the main, like the GI system and its failure is basically my entire life at the moment. I'm just learning how to deal with a chronic illness of this scale and what's needed to maintain myself, i.e. feeds. I need to have nasojejunal feeds, NJ feeds, and I've had this for the last 7 months, trying to give me some nutrition and build me back up from all the weight loss. I have yet to gain any kilos, so yeah, there's those two. I also have POTS, which is Postural Orthostatic Tachycardia syndrome, and that is where your blood flow and all that sort of stuff doesn't work correctly. Sorry, I nearly choked on my own spit. So to put it very basic, it's when, I'll give you an example, when you stand up, people's blood pressure naturally drops a little bit, but when you have POTS and you stand up too quickly, that blood pressure drops so dramatically that your heart starts beating a lot faster and can go up to 150 plus beats per minute, and then you pass out. So that's a bit of a shitter to have as well, because it gives me so much fatigue, which is what I was going to say next. I was diagnosed with chronic fatigue syndrome years ago, and that was before we sort of came across POTS, and that can in itself cause a lot of fatigue. So I don't know whether I actually have chronic fatigue syndrome. I think it possibly lies under the POTS label. So I have that. I've also got chronic daily headaches and migraines that do not go away. I have had them since I was 14. I wake up with them, I go to sleep with them. I do not have a second without pain of some sort in the head. And they've never been able to find what causes that with me. The migraine side of things, it's genetics, because there are a few people in my family that do get migraines. So that's been ongoing since the age of 14. I have functional neurological disorder, which it kind of reared its head after a very traumatic experience. So 5 months after that experience, that particular experience, I started having seizures. They're not epileptic seizures, they're psychogenic seizures. They are real seizures, but they are not ones that come from a place I don't know, it's not epilepsy. So I also suffer, until last year, all my life before that was more depression and PTSD and that sort of stuff. But last year I started developing extreme anxiety, which people or family would often say, just don't think about whatever you're thinking about that's making you anxious. The problem was, I wasn't thinking about anything, or there was nothing that was making me anxious in the head. It was a physical anxiety. So from the moment I opened my eyes in the morning, I'd be hit hard in the gut with just this dread feeling really nauseated. I couldn't eat. Initially, I started losing a little bit of weight and I had an NG tube put in, and that did not work because, like I said before, with gastroparesis, there's paralysis to the stomach and it's just not working. So that particular type of feed, like the NG feed, did not work for me and probably doesn't work for most people with gastroparesis. So I have a NJ tube which goes down to my jejunum, so it goes right through the stomach, down and into the jejunum. So my feeds go into my small intestine rather than my stomach. So that's basically the chronic side of things, and it is a daily battle. I cannot do things these days like I used to be able to. Even housework, cooking is very hard for me because to start with, I'm a really shitty cook. Really, I'm so basic. My husband cooks way better than I do, but even those things that I think I should be doing as a mother and a wife, I just can't do, and that's hard to wrap my head around. So sorry, I had to stop the video because my mind went totally blank and I didn't go back just then and see what I had said. So my memory, that's right, I've got no memory, no autobiographical memories, or very little, because I had a lot of electroshock therapy, like 80 plus treatments, and it's caused severe long-term memory loss, so and short-term. So sometimes I could be in the middle of a sentence and then think, what was I actually going to say then, or where was I heading with that, because I can't remember what I just said. Anyway, with the food and cooking, yes, I'm a shitty cook, a very bland cook, but I struggle these days with even dealing with food because I can't really eat it, because of the choking. And even if I wasn't getting things stuck in my throat continuously, if I ate, I would feel sick and I would get a lot of pain in my belly. So there's also some sort of dysfunction where my bowels and that aren't, the motility isn't great there either. So yeah, that's all I was going to say for this video, was to just knock it off and give you the long list of things that that I deal with on a daily basis. And so when I start going through and doing more videos, I'll be a little bit more precise. The topic will be, you know, something specific, kind of like next one I may talk about just gastroparesis. I don't know, I sort of wing it with things like this on YouTube. But if you would like to follow me while I'm still trying to figure out my health stuff, and my doctor is as well, then please subscribe to my channel, because I will keep on uploading videos. I am having surgery. Actually, that's one thing I do have, SMA syndrome, which I had never heard of until a couple of weeks ago when my doctor noticed something in an endoscopy, and then I was sent for a CT angiogram. So that is superior mesenteric artery syndrome, and it's where your aorta and your superior mesenteric artery are at an angle like that. There's a fat pad here, and then your duodenum goes through that area. So because I've lost so much weight, I'm so malnourished and underweight and have been for so long, that fat pad has decreased or almost disappeared, which means that those two arteries are compressing my duodenum, and that is causing pain and feeling sick and all that. So he's going to try and correct that. I don't know the actual full-on details of what he is doing. It will be laparoscopically done, unless something turns a little ugly in there and he needs to open me up quick. But I will be having that, and I will probably talk around that time when I'm in hospital, when I'm recovering and all that sort of stuff. So if you have any GI issues, or are looking at, like, watching this right now and thinking, man, I think I've got something like that, like when it comes to GI things, gastrointestinal stuff, yeah, stick around and like this video and subscribe, like I said before, because then you will be able to get a diarized type thing, not in writing but in voice. Anyway, that's all I'm going to say for today. Thank you if you are watching this, and hopefully my videos that I am still yet to do are helpful for you, because I found a lot of other people on here with similar problems. I found their videos extremely helpful, and they were who got me to go to the correct doctor in the first place. So anyway, I might sound like I'm droning on a little bit here, but yes, that's my list of medical stuff. Anyway, until next time, see you later, guys.